treatment experience with all the participants. Our webinar today is experience of COVID-19 survival and vaccinations. So welcome everyone again. Amidst the global COVID pandemic, anxieties and fear are on the rise across the world. In this seminar, we will explore the experience of myself, Meckhayai, Executive Director at Thai Chamber of Commerce. In fact, this journey intends to describe what actually happened in the process of the COVID-19 through my experience. Also, as a number of people might misunderstand due to wrong information obtained from invalid agents. So after my experience that I will share, will be followed by Dr. Nam. She will further explain the medical process involved with the COVID treatment and to update information regarding the COVID-19 vaccination in Thailand. So Dr. J will provide this information. All right. Yes, I would like to officially introduce two doctors, Dr. Nam and Dr. J. So Dr. Nam, she actually a doctor who take care of me during my hospitalization during the COVID treatment. So Dr. Nam obtained her Bachelor of Science degree in Biomedical Science from King College, London, UK. She then pursued her medical training at universities of Lancaster, graduating with a Bachelor of Medicine and Bachelors of Surgery degree. She spent a number of years after graduations working in Avaras Government Hospital in Singapore. She later took up the positions of a family physician in private healthcare group before a return to Thailand in 2018. And Dr. J graduated medical degree from Chulalongkorn University's Bangkok. She was internal medicine residencies at Albert Einstein Medical Center in Philadelphia in 2013 and did sleep medicine fellowships at Temple University in Philadelphia. She specialized in internist and sleep at J Care Senior Medical Center in Atlanta. Then she came back to Thailand to become internist and hospitalist, integrating healthcare at Bangkok Hospital in 2019. Yes, please. Next slide, please. Today, our content will divide into three sections. The first one, the experience of COVID-19, which will be myself, will talk about it. And the second part, we'll talk about the treatment and vaccinations by Dr. Nam and Dr. J, and Q&A sessions. If you have any questions may arise during my presentations or Dr. Nam and Dr. J presentations, please leave it in the note or in the chat box. Kun Pam, our event and marketing manager, will take care of it, give them the questions, and then we will start asking the questions later on. Next, please. So yes, to my presentations, I will share my experience of the COVID survival. Actually, I don't really want to say that I'm the survival. It's kind of like survival is a word of like when you go to the really hardship of something and you survive a bit. So my case is actually pretty mild, even though I got a lung infection, but I don't have difficulty of breathing. So next, please, Belle. So my content will divide it into four parts. The first part is before positive. The second one is first and the second week, which is the critical week. The third part is third week and fourth week, which is I already got out from the hospital and remain self-quarantined at home. And the last section, the fourth, is the fifth week onwards, what I do afterwards. Next, please. So before before test positive. So basically, I do the normal life, really self-care a lot. I'm washing hand regularly, wear mask at all time. But actually my symptoms start on the April 8th. On April 8th, I start to feel tired, muscle ache, and a fever. So I feel like this is weird because I normally don't have any fever for a year. It's rare that I had a fever. So I took the medicines and I just like curious like what happened because I never had a fever before. So I just like a little bit panic. So we searched through the hospital to do the test right away because the next day my brother have to fly back to Chiang Mai because at that time he took a long holiday for the Songkran festival. So we have to be precautions. So I do the test right away at night, but unfortunately at 9 p.m. no one available for the test. So we did again on the April 9th. So on April 9th, we went to the Bangkok Hospital drive-through. At that time, it's overcrowded. We wait for like 3-4 hours to get the drive-through accepted. So luckily we were able to get tested. So the result came 2 days later because of a lot of people went through at the time. So when the result come in, what I did is I traced back from the day that it might be potentially got the COVID. I found out that the April 4th is the date that that might be the high potential that I get COVID because I attend attend the event with a lot of people, and it was reported that 5 people, including me, at that event got the COVID. So that would be it's the day that I think that I get the COVID, and the symptom shows 4 days later. So on the pre-COVID, this is all the symptoms that I have. Like on the April 4th and to 6th, there's no sign of symptom at all. I live my normal life, mask all the time. I like at my house, I live with my brother and my girlfriend. So both of them are high risk as well. So on the April 8th and 9th, we went together to the Bangkok Hospital to get tested. Luckily that my brother and my girlfriend did not get infected. They test negative twice, but my girlfriend test negative 3 times. So they were so lucky. So on the April, like next please. So after get the report, I think when I received the call from the hospital, like the day before, like both of my brother and my girlfriend test positive. It's kind of like a little bit chill because I don't think like myself get it because like both of them also like test negative. So but like when the test result of my brother came out, but like except me, I just start panic because why because we test together at the same time. Why I'm only one did not get the test. So in the afternoon, the doctor called and then, hey, Jane, you got a COVID. And then I just, my knee is like weak. Like what I do next was I put myself together, relax a little bit, do a little bit like breathing exercise, put myself together. When I stress, I normally write everything down. And I will show later what I wrote. Which is really helpful for the doctor as well. I wrote everything down. I wrote a lot, and I start to read a lot as well. I start to consult my doctor friend, and my doctor friend immediately asked me to buy the oxymometer, the oxygen meters. So like the first day symptoms is I got like tardiness, a little bit muscle ache, extremely low energy. I kind of like really tired, doesn't really want to work, like stay on the bed all days. Breathing a little bit warmer because I have a fever, and it's basically it can be taken care with 1 Tylenol tablet or 2, so it's not that severe. So things that I do get myself together, write a message to those who I came in contact with in the past 14 days. another tips that I would like to recommend if you don't know where you went on the past 14 days, if you use Android, Google timeline tracking is also really helpful. So you can scroll through the number of days that you were, and it will tell you which location and what time you were there. So like some people might find it privacy, so you turn it off. So, but also like if you don't have this system installed in your mobile phone, you can also look into your calendars. Like if you are like a businessman, you probably follow your calendars day by day. So like when you write a message, I just forward it to everyone that I came to contact with in line message, in WhatsApp, in Telegram, you named it. Just inform people that, hey, I got COVID. Yeah, surprise. And inform the condominium. It's really important. Like if you live in the condominiums, so you have to inform them because it's affect other as well. You use the same elevator, you use the because like some condominium, they have different policy. So when I inform them, so they inform my condo, they basically inform everyone in the building that there's a case in this building. So they offer like, so they put like a table in front of my rooms, and also the separate garbage bin, garbage can. So they have like infected garbage can. So with the like biohazard side. So and they will instruct us not to come down. So whatever delivery come in, so they will put in front of the room. So that's like my luckily that my condo managed really well, and they take care and in charge very quickly. Like when they informed them, like kind of like an hour later, we have a table, we have the garbage can, and like next 2 hours, we heard like a lot of people in front of the room spraying. I don't know, I probably clean up. Another thing that I do is monitor yourself regularly, temperature, heart rate. I think like oximeters, you also get like the oxygen and the heart rate as well. And also like you should buy the thermometers to check and monitor your temperature. What I did, I also create my tracking sheet, which track my temperature, oxygen, drug that I take, medicine that I take, vitamins, and the symptoms. So and then the most important is to isolate yourself from others. Luckily that I have my girlfriend taking care of me, so I basically stay in the bedroom, and she stay in a separate bedroom. We separate toilets, kitchenware. So I clean my plate myself and put in my room. So she just dropped the food in front of the room. I opened it and take it into my room and close the door. So that's what I do. What I did when I was self-quarantined at home in the first 7 days because of the overcrowded hospital have limited capacities. Next, please. So after the first day, second day until the 7th day, so I do the self-quarantine at home. So normal symptoms as the COVID patient has like tidiness, muscle ache, dry cough. Actually, like I got the blood as well, just a little bit, sore throat, and start to lose taste and smell. So I just a little bit. I was panic as well. Like I don't smell anything. Like I don't taste anything at all. It's as you see in the video in the YouTube where the YouTuber got the COVID and eat a lot of chili. So that's kind of like no effect. I don't taste anything or smell anything. So things to do. So yeah, regularly monitor yourself. I read in the article about the light exercise to test your lung capacities, like a little bit light jog, 10 minutes. And what I do a light jog 10 minutes. And when I do it, I test my oxygen in the blood before, and then after that, see how oxygen percentage change. So I read that if you, doctor might want to jump in if I'm wrong, if your percentage of the blood drop when after your exercise, so it's indicate that your lungs start to have problem. Next, please. So yes, this is the graph and also the data that I input. So when I stress, so I tend to go to the fact, by the fact, and what I do the temperature check, I do the oximeter check, heart rate. This is all the graph that I did with my girlfriend. So in blue is mine, in red is my girlfriend. So she have like a higher oxygen in the blood 100% all the time. I kind of like 98, 97, like drop and increase. Heart rate, it's kind of like things that I do to kind of like stress relief as well, to see like, hey, today is like higher and today is lower. And sometimes like when I, like during pre-COVID, I do like a lot as well. Like sometimes like when one day I test like oxygen like 20 times because of like it's also like stress relief as well when you see that, hey, you are normal. So it decreases your stress. But like in the normal case, you should just check like 2 or 3 times a day. I think it's normal. Yeah. Next, please. So this is the symptom nodes medical tracking. So I divide it into a location that I was. So that's kind of like pre-COVID, pre-positive. And then in the big section is daily notes. So I divide the day into 3 parts, morning, afternoon, and evening. So I jot down everything, what I feel, what I facing difficulty, and essentially it's a daily journey as well. And then medicine that I take, Tylenol or vitamins or something else. Yeah, next please. The second week is when I got into the hospital. But before I got into the hospital, there's a little bit drama at my condo that others residents gonna sue me because they're afraid that I'm not going to the hospital. They inform the jurisdictions and to tell me that they're gonna sue me if I not go to the hospital. So basically, I have to call the Bangkok Hospital, like whether I got bed or not. Luckily, I got bed at the hospital because so I went to the hospital first. So the procedure at the Bangkok Hospital is that, so if you come in without any symptom, you go to the hospital. But if you have a symptom, either fever or cough or lung infections, they will move you to the hospital ward. So at the first day I went, the hospital did the X-ray check on my chest, which I will show the X-ray film later. So they found a tiny infection in my lung. So they moved me from the hospital to the hospital to be like more care, because it might be developed into severe. Yeah. So they moved me to the hospital close to the doctor. So the symptom when I went to the hospital, luckily that I don't really have any severe symptom. Dry cough, it's just a little bit with the blood. Sore throat getting better. Still losing sense of taste and smell. So lastly, tiny infections. Things that I do, I still keep monitoring myself, and also luggage. You also should prepare for your luggage. Like just prepare for your vacation for 10 days. Think about like 10-day vacation, just put all the clothes in, all the things that you would like to do. Another thing that I brought with me that, like I say like, oh, I'm not gonna work. So what I did, I brought another laptop, like gaming laptop, to play games all day. So yeah, so that's what I plan to do to relax myself, chill out. So I didn't have chance to play game at all. So I bring my laptop to play games, and also like sleep a lot as well. Drink a lot, drink water a lot. So that's help. Relax. Don't think too much. That's kind of like help your body regain and recover faster. Do things that you like. You can bring a lot of books to do. Many things that you can think of. You can Google it. I Google it like 100 things to do in self-quarantine. So it's a long list that you can do. Next, please. So this is my lung. like what you also need to do that I advise you, if you got the infections test positive, you should get your ask your hospital for your health check record. So and then you give to the hospital that you admit to. So my case, I got my lung my chest X-ray on 2019. I also give this to the doctor to be a benchmark. Perhaps Dr. Nam, my doctor at the Bangkok Hospital, perhaps you can explain a little bit on my chest X-ray.
Okay, sorry, Mr. Chen, can you see the arrow?
Yeah.
Okay, so if you look at the area in the red box on this chest X-ray, you can see this area here. It looks thickened compared to the previous X-ray in November 2019. So this indicates, new infection. Okay, so this is what we call pneumonia. Okay, in a COVID-19 patient. Yeah, and this X-ray is a follow-up of X-ray. Mr. Chen was given an antiviral medication, and this is what we normally do for COVID-19 patients. So we do another repeat of chest X-ray just to follow up on his progress. And you can see that this area is actually, it looks less compared to this picture. Okay, and this is his most recent chest X-ray, and it looks back to normal. Okay.
Yeah. So actually, for this presentation this morning, I went to the BDMS Wellness Center for another X-ray because I curious myself too. After a month of recovery, how my lung will be, and also this also will help perhaps the audience to understand how lung get infected cure after the viral medicine, and also like a month after, so how it was, how it will be. Next, please. And the third and the fourth week, which is after got released from the hospital, I like the doctor will ask you to stay quarantine yourself at home for another 14 days. So what I did, I also like still separate my room, my kitchenware from my girlfriend, and the symptom is basically getting improved. I'm from like improved. I started to smell and taste. Everything went back to normal, no fever. So another thing that doctor said, if you have a fever or if you still have like dry cough, it's not a good sign. If you recover, so you will have like turn things to normal. It will be normal. So what I did, things to do, still monitor myself, temperature, oximeters, heart rate. What I did before the COVID, during the COVID as well, I do it like exercise to see my lung. So everything is normal. Next, please. So after the 5th week onward, so I think so COVID have impact my life a lot, and it's changed my routines, my food and sleeping and wellness, overall wellness. So I still monitor myself regularly, like from that day onward until today, to see the trends. And it's also like help you to realize how your body react to a certain thing, like when you from your eat, from your sleep. It's also help you. It's also like changed the lifestyle. For me, it's changed tremendously. I care more about what I eat. I do more about like preventions, and also prevent others to get affected as well. Wearing masks all the time, it's really critical. And also when you go out to shopping, it's kind of like it's in the mindset that you have to be more careful than others because you have like COVID once, and this doesn't indicate that you don't got infected for another time. So there is a chance that you can get infected. But Dr. Doctor will talk about this later in her presentations. So this is what I came through, and I hope that my experience will help a lot of people understand about the COVID. It is really bad, but when you get it, it's not that bad. My lung came back to normal. But for other people with severe, might be different story. But this is the story that I would like to share, and I hope that this experience will also help you understand something about COVID. Thank you, Kap. Next, I would like to invite Dr. Nam and Dr. Jay to share your expertise about COVID treatment, floor, and also the vaccination.
Okay, so first of all, good afternoon, everyone, and thank you for having both of us here. I'm Dr. Nam, and this is Dr. Jay next to me. Hi. So I think we want this session to be both, informative and fun, hopefully at the same time. Okay, so if you have any questions at the end, please ask us. It could be regarding anything, COVID-19 vaccines. And we'll try our best to answer you. Okay, so I'll start off by, just to give you a broad information on the testing process at Bangkok Hospital, and also what happens if you are tested positive for COVID-19. And Dr. Jay will speak to you just regarding the monitoring process and follow up and what you should do after you leave the hospital. Okay, so what should you do if you have any of the COVID-19 symptoms? Okay, so if you have any of the symptoms here in the left-hand column, then you should come and be tested. Okay. So it could be at your nearest hospital, but in terms of Bangkok Hospital, we've got 2 places that you can be tested, okay? And this depends on whether or not you have any symptoms, okay? So COVID-19 symptoms, there's a big range if you see on the internet, listen to the news, okay? But common symptoms would include fever, or if you have any cough, any sore throat, any runny nose, okay? Diarrhea, change in your sense of smells or your taste, okay? So at the moment, we've got the ARI clinic, and unfortunately, we don't open every day, and we only accept appointment-based only, okay? So you have to call up the hospital and book yourself a test slot before coming in. So if you don't have any symptoms, okay, and you just want to be screened for your peace of mind, or if you're planning to fly somewhere, or if you've been discharged from the hospital and you want to get tested again, then you can come to the non-ARI clinic. So you won't be mixed with people with symptoms, okay? And again, we only accept appointment-based only patients, okay? Now, depending on how you are, if you're well enough to go back to your home, go back to your condo and wait for your results, then you can. And we will give you a call 24 hours, usually 24 hours after you've been tested, okay? But every now and then we do see patients who are really unwell who come in to be tested, and they have to be admitted while waiting for their test result. So what we do is we usually admit those patients into the cohort ward while waiting for the test results, and we give them treatment according to their symptoms or what we think is necessary for the patient, okay? So if you get admitted, we can give you, on top of medication, there'll be chest X-ray, and there'll be further blood tests that we can do for you, okay? So if you are tested positive, and okay, so like Mr. Jen, he was tested positive, but because of the bed crisis that we had last month, he had to be placed on the waiting list, okay? And we call Mr. Jen in when we had the available bed. So what usually happens is once you get admitted, now depending on how severe your symptoms are, you could either be admitted to hospital, which was where Mr. Jen was admitted initially, or if you have any symptoms or any changes on your chest X-ray, then you'll be admitted within the hospital wards. And so what usually happens is when you come in, we will do a baseline blood test for you. Everybody will have a chest X-ray done, and one of the doctors will give you a call just to speak to you, ask you about what kind of symptoms you have, and then we will assess on the severity of your COVID-19 infection just based on these things, okay? Now, bear in mind that most of the consultations between patients and doctors will be done over the phone during your hospitalization. And this is purely just, for us to minimize contact with COVID-19 patients. But if needed, we will go in and we will examine you, okay? So there will be a doctor on standby throughout the day and at night time as well. Okay, so depending on how bad your infection is, with COVID-19 infection, most of the treatment is actually symptomatic treatment. And what does that mean is we give you medication according to your symptoms, okay? So if you have any signs of pneumonia, meaning a chest infection, or if you are considered at high risk patient, meaning if you're 60 years old and over, or if you have any chronic medical conditions such as diabetes, chronic lung condition, or heart disease, we will consider giving you an antiviral medication, okay? Currently we have 7 teams of doctors looking after COVID-19 patients, okay? And in addition to that, we do have infectious disease specialists and respiratory specialists on standby every day, okay? And these 2 specialties are extremely important for COVID-19 patients because they will help us assess the patient in terms of whether or not each patient who will benefit from the antiviral medication, okay? And if you are unlucky enough and you develop severe COVID-19 infection, which means severe pneumonia, severe shortness of breath, which you don't improve with the normal oxygen, with the normal supplemental oxygen we can provide you in the general ward, then you will move you to the critical care unit and you'll be taken care of by the intensive care doctor as well. Okay, on top of this, so even if you remain well or have mild symptoms in the general ward, we will still, give you a call every day, and nurses will go in and monitor your temperature, oxygen level, your blood pressure on a daily basis. And for most of the patients, we will usually repeat blood tests and chest X-ray after 3 to 4 days of the admission, just to make sure that everybody remains stable in the ward.
Okay, here we're going to talk about the monitoring and follow-up. So basically, after you've listened to Dr. Nam, who just told you about what's happening in the hospital during the hospital stay, normally we would keep the patients in the hospital for, until 14 days after you're tested positive. So our hospital policy, currently we count the day that you're tested positive as day 0. And in this situation, when our bed crisis is getting better, you normally would be called back to the hospital within 24 hours, I would say, to be admitted to the hospital once you have tested positive. And you will stay in the hospital for, until day 14. I mean, to complete the 14 days after you're tested positive. And then the next day, which is day 15, you can be discharged from the hospital. This is only if you're asymptomatic or your symptoms have already resolved. For people who still have problems with their breathing, or you're still symptomatic on day 14, you may be kept in the hospital longer. Normally we would discharge the patients after their symptoms have resolved 24 to 48 hours. And as well as they have completed the antiviral agent as prescribed by the specialist. So after you're being discharged from the hospital, what's going to happen? Normally, we would recommend you to continue the home quarantine for 14 more days. Well, this was originally recommended by the government sector as well. However, there's been changes in terms of the government recommendation. I think the current recommendation from the government is that if you're kept 14 days in the hospital and being discharged, you can return to your routine like life with precautions, of course, like wearing masks, washing hands, social distancing. However, we've seen a lot of cases that are tested before discharge, and we've seen cases that still tested positive on the day of discharge, even though that might be a dead virus that we found. And that doesn't mean that they're very contagious at that point. However, just to be on the safe side, we always recommend patients to try to do home quarantine for at least 14 days after they get out of the hospital, if possible. Talking about retesting, like I got a lot of questions regarding whether you need to be retested before you leave the hospital. And the answer is no, it's not required or even recommended that you need to be retested. We only do the repeat swab test on people who either need to fly back to their country or need to return to the residence or the return to work that their company or their residency requests the repeat test result. We will do that. And the only reason that we don't retest is because different people have different rate of recovery. And at one point, we didn't have enough capacity or capability to do enough tests per day to cover all people who have symptoms or have been in contact with the cases or in high risk situation. So we try to use resource that we have, the best we can. After you get discharged and you're doing home quarantine, what you need to monitor is, of course, your symptoms, like Mr. Jen was telling us about, he was monitoring his oxygenation, his temperature, his symptoms. And in some cases, we would set up an appointment for the patient to return to the hospital for a follow-up chest X-ray if the chest X-ray at the time of discharge is not normal yet, or follow up on other symptoms or other medications that they might be prescribed back home. And well, one of the most common questions that I get these days is whether they still have to get vaccinated if they already have COVID, because you would assume that you get some sort of antibody developed from the viral infection, and that's true. Your body does build up antibody against the virus once you have the infection. However, according to the studies that we have so far, these antibodies would stay in your body like only temporarily, and eventually it might go away, or and you still is recommended. You're still recommended to receive vaccine. However, the time of your vaccination would be a little different, meaning that normally we recommend to wait about 90 days after the infection before you get a vaccination for the COVID-19. All right, and now we are open for questions regarding the COVID-19 disease, the treatments, and the vaccines.
Thank you, Dr. Nam and Dr. J. So we have some interesting questions, and also we have some questions that pre-asked before the event. So the first questions that we have is, should I still? Oh, okay, that's one. It's already you have been answered. It's about the whether we should have the vaccine if you got already past the COVID. So it's after 90 days, right? That I recite. Another question is wearing two masks versus one mask. Is that help? Is a bit more effective to prevent the COVID?
Oh, what? Sorry, can you repeat?
Wearing two masks or one mask, is it help better preventing the virus?
Well, it depends on what type of mask you're using. Okay, so
Yep.
so studies have shown that if you wear okay, so I'll say the least effective would be a cloth mask. Okay, so if you compare that to the medical grade N95 with the medical grade surgical mask, like what we're wearing right now, and a cloth mask. Okay, so cloth mask has the least efficacy or the least efficient in terms of filtering what goes in, okay, or what's coming out. A surgical mask, medically grade surgical mask would be a better option for the general public, okay? And recent studies have shown that if you wear a surgical mask first, and then you cover your surgical mask with a layer of a cloth mask, so that increases the filtering efficacy. So if I'm not wrong, it can go up to 80%. Okay, so, but of course, the best would be the medically grade N95 mask. But I'll probably say that's not the most comfortable to wear out in public. Okay?
Basically, the objective of wearing a cloth mask on top of the surgical mask is to increase pretty much the fitness of the mask and
so,
to pretty much seal.
So if you look at what I'm wearing right now, this area here across the bridge of the nose, okay, there's a wire here, so you have to press it deeply, okay. I'll say the area that we're worried about is actually the side of the mask, okay. So if you put on a cloth mask over your surgical mask, that tends to seal up any leakage here. So that would be a better fit or better option for the general public as well.
Okay, Kap. So thank you, Kap. So basically, two masks is better than one mask because it's like seal up the roof hole, the area that the air can get in. Okay. So another question that we have is about the plasma donations from COVID patient. Is that help? How it's helped current COVID patients?
We've had a few cases that developed very, very severe problems like lung infection from COVID. And we have seen that the plasmapheresis were used in those cases. However, you know, since we're not doing this too often, the data that we have is very limited. But if you are one of those who are healthy and, you know, could donate your plasma after the COVID infection, I guess that would be beneficial, you know, to not only the sick people, but also to our, you know, like pretty much for educational purpose that they can do the research and study on these.
Okay, Kap. Thank you, Kap. So next question is, what is different between antigenic test and RT-PCR test? Is that different how accurate it is and how I think like genetic tests probably contribute to a lot of false positive, right? Or maybe both. Maybe can doctors explain on this?
I'll say right now the COVID, okay, so the abbreviation would be COVID-19 RT-PCR, okay, and I think currently that's the gold standard for COVID-19 testing, okay. So it stands for COVID-19 reverse transcription polymerase chain reaction, okay. So that's the swab test I'm sure that was done on you as well, Mr. Jen, okay. And the antigen test is usually done by blood sample from blood test. In terms of accuracy, I would say the RT-PCR is still the recommended test for COVID-19. Antigen testing, we don't usually encourage people to go for antigen testing, So if you really want to screen out COVID-19, the recommended test right now would be the swab test, the RT-PCR test.
And it is very specific, meaning that I would say that if you have a positive test result, it's very low chance of the false positivity, meaning that we normally would take it as a yes, you do have infection.
Because normally if you're tested positive on the COVID-19 antigen test, we still send the COVID RT-PCR test after that just to confirm the result.
Thank you, Kap. The next one we'll ask about the vaccine. So do you know what is the COVID vaccine policy updates here, especially for foreigners in Thailand? Because I think like this session is 90% are foreigners, and they're curious about the vaccinations policy for foreigners here in Thailand.
Yeah, I'm sure, we all are. And we actually have had a few sessions like this, talking about vaccine for expat. And yes, we are sure, well, we hope that eventually all the population would get, and not only limited to the Thai nationality, because, foreigners are in the community as well, and we consider them, if we vaccinate them, that's another way that we can, build up the herd immunity for our country. However, our hospital, the private hospital, we don't really have control over, first of all, having vaccines or choosing what company we're gonna buy vaccine from. We're waiting for the pretty much an okay or a policy from government sector, and we expect that by the third quarter of this year that we would be able to deliver or to vaccinate expat. However, there's no confirmation just yet.
Thank you, Kap. Another questions regarding vaccines and the natural immunities. Question from Foy is concerning the vaccinations of the people that recover from the COVID before. Are you saying that it has been proven that antibodies from the vaccines last longer than those from the natural cause of disease?
I'm not sure if there's really a big study about how long does the immunity last in terms of people who get vaccinated. But for people who got infection, it lasts about like a few months after you get infected. So for sure, we do know that those group of people need to be vaccinated, even though they already had infections. The question that you asked, if you're vaccinated, how long does the immunity last? That would answer the question whether, like, when do we need to get revaccinated after we have the first vaccination? And this question is still, in the air. We're still doing the study to answer this question. And I believe it's very possible, since because of the mutation and stuff, that COVID vaccine might turn into something like an influenza vaccine that people need to be revaccinated every year. But this is still being studied right now.
Okay. So next questions from that question. So can we get vaccinated twice? For example, already received 2 shots of like Sinovac, and then later on another 30 days, 60 days, get another like Moderna or Pfizer. So is that recommended or?
According to the information that we have right now, the answer to that question would be yes.
Yeah, so basically, I think people are concerned because, they might want to get Pfizer, but it's not available right now. So they ask, could I go ahead and get the Sinovac? And then in the future, if it's available, I can get revaccinated with the Pfizer one. And yes, you can. It's not, getting already if you're already vaccinated, that doesn't mean that you cannot get vaccinated again by other brands of the vaccine. There might be a little recommendation about the timeline, whether how long after completing the first vaccine set that you can get the second one, and that is also being studied. But if you ask me right now, I would probably recommend that maybe at least a month apart that you can go ahead and get in the second brand vaccine.
Another question from our audience about the insurance. So providing a private insurance from Aetna, AETNA for foreigners, what Bangkok Hospital experienced with this insurance company for reimbursement related to COVID treatment? Because I think a lot of like expat that he know have taken the private insurance with Aetna. So does doctor have any knowledge about the insurance on this?
Oh, I think it depends on.
It depends on what kind of insurance policy your colleagues are holding actually.
Yeah, we've been having people who have Aetna, but depends on the policy that they have.
But for example, for Thai person, for example, would like it will be reimbursed by the government or partially reimbursed?
By the government, you mean? Well, if you're Thai, I know for sure, even if you don't have private insurance, the government would take responsibility.
Okay, so being Thai nationals, whether or not you have a private insurance or no insurance, the treatment, the admission, everything, the process will still be the same. And usually, from most of the cases that we've seen, the government takes care of the cost of the hospital admission.
Thank you, Kap. So about the vaccinations, what is recommended for the vaccine for people who are over 60 years old?
Right now, well, based on the only 2 brands that are available in Thailand, we would have more information for elderly, or people who are over 60 years old, more in the AstraZeneca brand. I think Sinovac is doing a phase 3 right now, and they're accumulating more and more information on people who are over 60 years old. So very possible in the near future we would see maybe more data on 60 or above for Sinovac. But currently it would be AstraZeneca.
Thank you, Kap. Another question from our audience. So I will read his questions. I have watched some videos on YouTube that claim to show that COVID is vascular viral infections and inflammations in the lung can be reduced by an antihistamine known as cryptophytamine, which reduce serotonin in the lung. What do you think about this?
I'm not sure I understand the question correctly, but
I'll say okay. So usually antihistamines are okay. So from the current recommended Thai guidelines, okay, the mainstay of treatment would be antiviral and steroid to reduce the inflammation inside your lungs. Antihistamines are given for symptomatic treatment. So right now we don't have any data to suggest using antihistamine to decrease the level of inflammation inside your body. Yeah. But we can look into it. Sorry, Mr. Chen, can you just read out that name of the medication again?
Hang on, it's pretty hard. Cycloheptamine.
Okay, well, cyproheptadine,
That's a very old antihistamine.
it's generally used to kind of build up your appetite. Like, you know, for people who have chronic disease that don't have much appetite. Just to add on to what Dr. Nam just said, we do have other medications that would help reduce inflammation in the lungs, which sometimes, you know, the severity of the disease comes from our body reaction to the virus, you know, that cause a lot of inflammation and, you know, tissue destruction. So we might have to use other immunosuppressant to control our body reaction. But I don't think antihistamine is one of them.
I'm actually Googling it just now. It's actually in a phase 3 study. Okay, so we don't have any confirmed information on the efficacy of that medication on COVID-19 just yet, but it is in trial. Okay, so it could be something new in the future.
Thank you, Kap. The next one is what the recommendations for vaccination for pregnant ladies as a part of vulnerable populations. At which week is it considered safe, and will the immunities be passed to the unborn child?
Well, I don't think at this point, well, pregnancy is a very, very special situation, and I think you have to really weigh the risk and the benefit. We have to judge it on case by case basis. If you were to really get vaccinated during pregnancy, then I would guess that the second trimester would be the safest period that you would get. However, you know, it's very important that you would discuss this with your, you know, OB about whether it's would be more beneficial compared to the risk to get vaccinated during pregnancy. However, I can answer based on my own experience for breastfeeding women, because I am with breastfeeding right now and I got vaccinated, that it is okay to get during breastfeeding.
Okay, thank you, Kap. So another one is like I read the question from the audience. So I have seen two types of face shield now. One where the shield seal against your forehead, and the other one use glass frame to hold the shield. The glass frame type is open at the top, like where the air like can flow in, can pass your forehead, pass down to your nose and your mouth. I assume that the type that's sealed against your forehead, it must be better and safer, right?
Well, I don't think we have a study that compare these two, you know, like a formal study that come out. However, the objective of using the face shield is pretty much to, number one, to decrease the chance of you touching your face and to prevent any droplet that might come in and touch other part of your face other than that is covered by a mask. So I don't think to seal the top part would matter that much, to be honest with you.
So what is the capacities? Another question from the audience. So what is the capacities that a Bangkok Hospital treat the COVID patients on the daily basis?
Okay, so right now with the ARI clinic, we only accept 50 appointment cases per day, and the clinic runs from Tuesday to Sunday every day. Okay, if I'm not wrong, it's, you know, from 9 to 3 p.m. Okay, but currently we only accept 50 cases.
Well, these will change according to the demand, though. I mean, if we do see that, you know, there are more cases around, there are more people who want to be tested or more people who get sick, you know, we normally would arrange and, you know, change the time and the appointments based on the demand. In terms of beds, we also have like a lot of cohort wards
Yeah, I mean, the bed situation is definitely better compared to what we had in April. Right now, we can accept
360.
360 admissions.
Oh, okay. Thank you. Another questions regarding the insurance. I understand that from the audience. So like when foreigners come to Thailand and they normally require to have the COVID insurance before pre-entry, so to make sure that they are covered if they got COVID. So is it so basically in terms of the reimbursement, for example, ITNA Platinum Plus. So it's covered, or the expat who have this similar insurance, or it's partially covered?
You know, we're probably not the best people to answer these questions because we don't deal with like financial part of insurance quite a lot. But you know, we will pass on the questions, and you know, and we can try to give you the answers somehow.
Okay, yeah, I can coordinate like the unanswered questions later regarding insurance from the Bangkok Hospital. So we will after this we will have like any of unanswered questions will be asked directly to the department that will take care of this.
Yeah, generally we do have like special department who deal with like insurance, and you know we would be able to deal with.
Yeah. And another question, which is really kind of like from our audience as well. They ask why our COVID test here in Thailand is more expensive than other countries. For example, he gave the example of the UAE around 1,000 baht, France is around 2,000 baht. So is it something to do with the pricing or
I assume this you're talking about the same like nasal swab, like
yes,
RT-PCR. I'm not sure.
I'm not sure. Yeah, we're not sure actually. But I think the price here is pretty much the same across, you know, other private hospitals in Bangkok. Yeah, but we were not really sure why it's more expensive here in Thailand.
Yes. Yes. Do we have any other questions? So perhaps I think it's almost the time, and perhaps we can open the mic for maybe deeper questions for audience. So we only allow two people to open the mic to ask directly to the doctor. So if anyone have any questions, please, I think you can raise your hand and we will turn on your mic. We only allow two questions. Is there anyone who would like to ask doctor directly? You can raise your hand. The button is on the reaction, so you can raise your hand. So we will unmute your microphone. 0. Yes.
Hello, can you hear me?
Yes. Yes.
Oh, hi. Thanks for very much for organizing this. I'm Jim from MBMG. I just had that very quick question on the ivermectin, or in general, if a patient wanted to take their own medication, like for example, supposing they wanted to increase the dose of vitamin D compared to what a hospital might be giving them, would they be permitted to self-medicate themselves with either a therapeutic such as ivermectin and increase the doses as they want, or would they have to strictly follow the hospital's standard for treatment?
Well, I would say that if you, once you've been diagnosed with the COVID disease and you're admitted to the hospital, then we would recommend that, you know, to let us manage the medications. However, if you're taking ivermectin or vitamin D just for prevention and you're doing that on your own, then you can. But once you're admitted to the hospital, we're pretty much responsible for, you know, your kidney function, your liver functions. We're giving you antiviral agents. So we would like to be the only one who manage what you're going to take in order to make sure that they don't interact with each other.
Okay, that's very interesting. Thank you. So do you think that ivermectin might be okay as a prophylaxis? Have you heard about that?
Yeah, we've seen patients, taking ivermectin by themselves at home as well, just to prevent COVID-19 infection. However, I think data are still very limited on, the efficacy of ivermectin in terms of preventing COVID-19.
Okay, thank you. That's good.
Thank you, Cap. Do we have another question? So last question from audience, from participant. Please raise your hand so we will unmute you. If there is no question, so I would like to conclude this event, and thank you, Dr. J and Dr. Nam, very much for your information, knowledge that you share with us, all the answer that you provide to all the questions that we have. Apart from that, unanswered questions at these sessions will be summed up, and I will pass to the Bangkok Hospital team to get answer, especially on the insurance part. So thank you very much for your participations. I hope to see you soon at any of Kanchan event in the futures. We hope that the COVID case will be decreased and that we can organize the Canada Day or Christmas event together again this year. So thank you very much for your participations, and I hope you stay safe and healthy, and see you soon at next event. Thank you.
Thank you.
Thank you. ขอบคุณค่ะ
ขอบคุณครับคุณหมอครับ
สวัสดีค่ะ